Hi guys, I'm Robbin Cohen. I'm the director of the lung cancer program, and welcome. This is the Education Center at the Huntington Cancer Center, and we're really glad you're here this morning. This is a program called Smoking Stinks. We're going to talk a little bit about what cancer is, and then we're going to get more specific and talk about what lung cancer is, and then we're going to talk about what lung cancer has to do with cigarette smoking and why you should never smoke. So really those pretty simple concepts. The first thing we're going to talk about is what cancer is. And cancer is, you all from your science classes know what a cell is, right? That the body is made up of millions and millions of cells. And so in cancer, one of the things that you have to realize is that cells are constantly being replaced in your body. They're dividing and replacing old cells all the time. When cancer occurs, the genetic makeup, the code that tells cells what to do, goes crazy in one cell. And that cell just keeps dividing and dividing and dividing, and then sometimes it goes to other parts of your body. And that's how cancer hurts you or even kills you. It's basically a mistake in the cell's genetic code, which allows those tumors to grow and invade and spread throughout the body. And this is a video that just shows how that happens. So if here are a bunch of cells, you can see that there's one mutant cell there, and it divides into two, and then those divide into four, and you can see this tumor, this cancer, starting to form. And it has the ability to do a couple of things. One is it keeps dividing, so it gets bigger and bigger. And you can see how the tumor in this sort of tissue in this video is getting bigger and bigger. And then it can even get its own blood supply. Little blood vessels go to it to supply it with blood and nutrients and things that cells need, and in order to allow it to keep growing. And then the other thing that cells can do is little tiny cells can break off from that first main tumor. And you can see this cell breaking off, and it gets into the bloodstream, and that's how cancers go to other parts of the body. They can actually travel by ways such as the bloodstream to get to other places, and then they can set up camp and start making tumors in those places. And that's how cancers kill you. That's how cancers become what we call malignant. And so if you look at a set of lungs, and actually this is a picture where we took a scope in somebody who was having a lung operation, and we actually put the camera inside the chest. We do this all the time. It's called video-assisted thoracic surgery. And you can see that this is what the surface of the lungs look like. They're mostly nice and pink, and all these little black things are just the smoke and the stuff that you breathe in day by day. When you smoke cigarettes, when you light up a cigarette and you inhale that smoke into your lungs, you can see that the lungs go down into the airways, and the lungs are just two really big sponges. And you can see how that smoke destroys the lungs over time. And this is what causes emphysema. Have you heard of emphysema before? Emphysema in people who are cigarette smokers, and also what causes lung cancer. And if you look at the lungs of somebody who's smoked for a long time, instead of that beautiful, fluffy, pink appearance, they look all black and solid and gooey and destroyed. You know, they look totally disrupted. So when patients get lung cancer, when the cells in the lung go crazy, you can see how not only has parts of the lung been destroyed and there's emphysema, but you can see these tumors in the lungs themselves. And when that happens, some people have pain. Some people tell you that they can't breathe well. They cough up blood. Sometimes you get infection around the cancers, and that causes pneumonia. It's just a setup for disaster in the lungs, and it's very difficult to make better. And this is a picture that actually shows you what cancer looks like in the lungs of a patient. You see all that white gritty stuff that's replacing the actual lung tissue. That's what lung cancer looks like. And lung cancer can spread outside the lungs into virtually any other organ of the body. And the places that it really likes to go are places like bones. It goes to the brain, the liver, kidney. It can even go to the skin. It can even pop up on your skin from the lungs. Some people, when you find the lung cancer really early, can be cured with surgery. And this is what that operation looks like. But it turns out that because it's hard to find lung cancer before it gets advanced, that's only about 1 in 5 patients. And the rest of patients who get lung cancer die. Simple as that.